Have you ever wondered how America's big pharma companies can seemingly dodge significant amounts of taxes? How is it possible that they report massive sales in the U.S., yet their profits appear disproportionately low? There's a mystery lurking in the shadows of America's national medicine cabinet. And today, we embark on an enlightening journey to uncover the captivating world of pharmaceutical tax avoidance. This is Senator Ron Wyden, a member of the Democratic Party and the chair of the Senate Finance Committee. He stated that
2 years ago, the Finance Committee Democratic staff began investigating these issues. Here is what Big Pharma doesn't want the American people to know about.
Our adventure commences with a startling revelation from the corporate disclosures of America's largest pharmaceutical companies. The numbers reveal a peculiar discrepancy. They report billions in sales within the United States, yet their profits seem disproportionately low. In 2022 alone, the 6 major U.S. pharmaceutical firms reported a staggering $215 billion in sales in the U.S., but their profits from this massive revenue amounted to a mere $10 billion, leading to a profit margin of just 5%. Surprisingly, despite the relatively modest sales abroad, totaling $170 billion, their profits from international operations reached an astounding $90 billion, resulting in a profit margin of over 50%. How is it possible? Despite systematically higher prices in the U.S., they claim to earn only a fraction of their profits in the country compared to what they make abroad. Are there hidden secrets behind these puzzling figures? Let's embark on our quest to find out. To grasp the gravity of this profit shifting, let's delve into a few compelling case studies. Let's shine the spotlight on AbbVie, the producer of the immunosuppressive drug Humira. The company surprisingly reported a staggering 99% of its profit abroad, despite generating only 3/4 of its sales overseas. More recently, AbbVie claimed to be suffering losses in America, reporting a $5 billion deficit on its U.S. operations in 2022. While simultaneously recording an astonishing $18 billion profit outside the U.S. Merck, renowned for the blockbuster drug Keytruda, reported a mere $1 billion in profit on its $27 billion in U.S. sales in 2022. However, they proudly boasted a massive $15 billion profit from their $32 billion in sales overseas. As for Pfizer, famed for producing the first mRNA coronavirus vaccine, their earnings showcase an evident disparity: $5 billion in the U.S. versus a staggering $30 billion abroad in 2022. The magnitude of these revelations beckons us to question the ethics and fairness of such practices, as well as the implications for the U.S. economy.
But Big Pharma pulled out all the stops to keep the details of their tax schemes hidden in the shadows.
As we venture further into the heart of this mystery, a cloud of smoke begins to dissipate, revealing the truth behind the illusion. Tax avoidance is the key culprit. While pharmaceutical companies assert that they comply with all tax rules worldwide, they have indeed mastered the art of legally diverting profits from their U.S. sales to low tax jurisdictions. Through careful manipulation of the U.S. corporate tax code, these companies exploit legal loopholes to shift profits made overseas to tax havens in the Caribbean and Europe. Before the 2017 tax reform, U.S. companies enjoyed the liberty to indefinitely defer tax payments on profits earned offshore, thus creating opportunities to move profits to these low-tax jurisdictions. By strategically parking their intellectual property and conducting manufacturing in these regions, they managed to shift almost all profits earned on U.S. sales overseas, depriving the U.S. government of much-needed tax revenue. What is the consequence? Americans pay exorbitant prices for vital medications, yet the tax revenues that should be reinvested in groundbreaking research at the National Institutes of Health and supporting pharmaceutical manufacturing jobs escape the grasp of the U.S. This revelation raises further questions about the ethics and fairness of such practices, and it is essential to shine a light on the implications for the nation's health and economy. Now that we have unveiled the smokescreen, you may be wondering how such tax acrobatics are achieved within the confines of the U.S. tax code. The answer lies in legal loopholes. Through this intricate process, the effective tax rate for most of the big pharmaceutical companies on the profits they keep in the U.S. is much closer to 10%. However, since the majority of their profits are shifted overseas, they end up paying only around 3% of their global profit to the U.S. Treasury. The impact of this profit shifting on the U.S. is undeniably significant. Pharmaceutical companies benefit from research and development funded by the National Institutes of Health and receive U.S. tax credits for their innovation. Yet, they contribute only meager amounts to the U.S. Treasury, depriving the nation of valuable tax revenue. Furthermore, the pharmaceutical industry is a crucial source of biopharmaceutical manufacturing jobs, which are being created abroad instead of at home. Fortunately, there are potential reforms that could address this issue and pave the way for positive change. One proposed solution is subjecting all overseas profits to a 15% minimum tax on a country-by-country basis, eliminating accounting tricks and ensuring fair taxation. Additionally, placing limitations on pharmaceutical companies' ability to claim tax credits for offshore research when intellectual property is moved outside the U.S. could discourage profit shifting and encourage investments within the country. In conclusion, the issue is a complex web of legal maneuvers that has significant implications for the nation. So how can we, as individuals and as a society, contribute to ensuring a more equitable pharmaceutical industry that benefits both the health of Americans and the nation's economic well-being?